For the person who's questioning how to disappear for 30 days, how do I get away from work, how do I disappear from home, I think there's a variety of answers. A lot of that's very individualized. With regards to family, somebody might consider, how do I provide for childcare? How do we provide for the children getting to school? How do we provide for spouses being able to pay bills if the person who's coming to treatment is typically the bill payer in the house? Some of those conversations really need to be had prior to coming to treatment or at the beginning stages of treatment as things tend to come up. Can you afford not to come to treatment? Can you afford to continue to have the unmanageability, the powerlessness, the fact that life is falling apart despite efforts to be able to keep it together? Outpatient treatment works for quite a number of people. However, many people need to simply unplug and be able to focus solely on one thing, that being the addiction that they're struggling with. And to come to treatment for 28 or 30 days allows them to do that. In order to really be able to deal with the issue in a way that is very efficient and that really deals with it the first time through. Ideally, we'd like somebody to have one successful treatment and that's it. So if somebody has tried going to meetings, has tried some outpatient therapy and is continuing to struggle with drugs, alcohol, or other behavioral addictions, inpatient treatment should really seriously be considered. I think when looking at a good treatment program, does the program address all aspects of the patient? Is there a mind, body, and spirit approach? When we're looking at treating addiction, do they understand and look at addiction as a disease? Not as a theoretical concept, but it is a disease. And how to treat that biologically, psychologically, and spiritually. Good treatment program is going to offer good psychological services, good psychiatric services, full medical services up to the ability of that treatment program. They're going to offer spiritual services for somebody to get in touch with their higher power and be able to understand that recovery is a spiritual journey. There'll be good treatment components with regards to cognitive behavioral therapy, dialectical behavioral therapy, motivational interviewing, understanding how the 12-step program works in reality, how to integrate into a 12-step program, how to introduce somebody into a 12-step program that really makes sense and ultimately can be very comfortable. A good treatment program is going to offer good aftercare recommendations. It's one thing to have a great 30-day program, but what happens after that? We want to make sure that somebody has a good footing for the next step in their journey. Are they going to someplace that is appropriate for their level of care, what their personal needs are, what their recovery needs are, what the family needs are? Is it financially reasonable to be able to go to that next level of care? Is there good treatment involved in that? And is there a helping hand to make that bridge, to make that transition as smooth and as efficient as possible?